And some of our therapies we actually involve outside agencies. We wouldn't have all the resources here for them. And we're involved with Music Network. And these are people who come and not only to tell the people about music, and they actually get them to make music.
They communicate so well between them. If one forgets a line, the next person knows it, and they have a great sing-song and the exercise combined.
We're warming ourselves up. We're getting ready for these exercises later on.
If you can, that's it. Lovely stuff. Feel that you
We're warming ourselves up. We're just getting
generate that energy.
Now let's feel the warmth now you have. Put your hands to your cheeks.
Yeah.
Take out the cobwebs. Take out them down there. You're all very fit. Right?
Do this spider now.
And we'll go for the... Jump down, turn around, shake your belly, jump down, turn around, shake your belly.
Well, I enjoy the music therapy. I think it's great for livening us up and listening to the music.
Well, the patients here would have grown up very much as part of Irish society at the time, where religion, I suppose the practice of religion was probably more important maybe than it is now. I'm not saying it's not important now, but you know, it was more traditional and maybe more regular. Maybe things of the whole society has changed, I suppose.
They never question their religion, and it's just embedded in their minds, and they get a lot of satisfaction out of it.
And in here they find they're able to continue their practice of their religion. So they're well looked after in the sense of their practice of their religion, and it's great here in the hospital in Mountmellick that not just the patients coming, but the parishioners come also, and it's a nice mix of hospital and parish.
People's religion was very important to them. In fact, it was number one. Our church was, I suppose, old and not suitable for people with disabilities, and again, big wheelchairs and all the rest. So we decided to look at a wheelchair accessible building, and we took down an old little altar, little wall that was there, and widened our doors.
That generation, the way they were reared, religion was number one. They get a lot of satisfaction out of it, and at the end of the day, that's, you know, number one priority for them.
One-to-one interaction is very, very important. I mean, we all love to have a bit of attention and have someone to talk to. So I feel that's very important as well. And they do reminiscence therapy, which is great. Old people love to talk about old times and past times, and they love to remember. And that's very important on a one-to-one level, but in a group situation as well.
But basically reminiscence therapy is what it is. We get people in the room and we ask them to remember their youth or things of their youth. And they're not all happy things. As we all know, 40, 50 years ago, life in Ireland was very difficult and very different to what it was now. The people that hadn't got money were in difficulty, and people who had money worked very hard to get it. And when we're reminiscing, they tell us the good things, the bad things, and then sometimes something clicks with us as a group of people that are leading this therapy or this reminiscence, and we try to build build it into reality, make it 3D, like the jigsaws. It's not just something flat. We make it live.
It's quite obvious that any diversion like that relieves the monotony of the place. For the patients there, they deserve their bit of pastime. So,
Like a fair day, it involves catering people, it involves people from the community, it involves staff on the wards who have to get the patients up and out to wherever the venue is, be it outside in the garden or in the main dining room or something inside. And then we have 3 and 4 weeks afterwards of talking about it and telling us what they remember. You remember in Mountmellick, in the fair days in Mountmellick?
Yeah, that is right. Oh, that used to be a great day out.
Basically, the day is a big reminiscence therapy session. Normally we have these reminiscence sessions inside in a room without the actual effects of seeing the tractor or seeing the cow or the horse. So basically, we have developed their ideas and recreated something from their youth and their past.
Just bear with us now while we set up the music and we'll be ready to roll in a moment. Taps around the house again. Pass through. Come on everybody, clap your hands to the music. Enjoy it all. Everyone advance. Right girls?
It's important, you know, that the patient is doing something that's familiar to them, something that they're comfortable with, not something that I think they might enjoy, but something in their past that they've associated with. So really, you know, it was very familiar for them to see all the animals outside and to recreate a fair day, and definitely it was enjoyed by them.
They're actually beginning to live their lives again and they feel useful again. They feel useful. They say, well, we're not sitting in the corner, doing nothing, and whatever we have to say, nobody listens. They see when we do something like the Fair Day or the St. Patrick's Day Parade or Valentine's Day, they see that we're taking on board some of the things that they have told us.
I'm from Portlaoise, and I'm so used to this place now that if I had all the amenities and care and attention I had in Portlaoise, I'd still rather stay here.
The simple things make the big difference, huge difference. You don't need rocket science in here to make somebody's life happier. The simple thing, the dog jumping up in the bed, the dog maybe taking somebody's slipper and going away with it. These are things that we see every day in our own houses if we have animals or pets around the place. And these are the things that make the difference here as well. It's no different than the domestic setting, except that we're 160 beds compared to 3 bedrooms. And that's the only difference.